This week's episode of Bariatric TV is sponsored by Bariatric Advantage, the most complete line of micronutrient replacements specifically designed for the weight loss surgery patient. Help support the show by ordering your Bariatric Advantage products directly from the BTV e-store. This week's show is sponsored by Celebrate Vitamins, providing the optimum level of vitamin and mineral supplementation that's tasty and affordable. Use the coupon code BTV459 at celebratevitamins.com for a chance to win a 30-day supply of the Celebrate product of your choice.
Hi, I'm Tony.
And I'm Linda. What do you know? We're still coming out with new episodes each week. And on this week's episode,
Another Freak of the Week.
Be sure to tell other doctors you've had surgery.
So what if you don't take your vitamins?
Are bariatric vitamins really too expensive?
Are you ready for this week's Freak of the Week? We're really excited about sharing them with you. This week's Freak of the Week hails from Pembroke, Massachusetts, and is none other than Roadblock. Roadblock wrote at the time that he submitted this, I had a RNY on February 3rd, 2009 at Tufts New England Medical Center, so I guess that means that I'm 3 months out and I have lost 120 pounds, including the 40 pounds I lost prior to surgery.
Why is he a freak? He says, dude, come on, it's not easy being me. I have a reputation to live up to. Now the bikers around here want to start calling me road sign, speed bump, and even traffic cone. Traffic cone? Come on. Is there anyone who wants to keep their knees thinking that's a good name for me?
Roadblock, we just love your energy and attitude, so that's why we've crowned you this week's Freak of the Week.
Well now, let's hit the road to the dumping ground.
Sound effects.
I don't feel good.
Welcome to the dumping ground.
Have you been to your gyno lately?
Have you been to your dentist lately?
What about your chiropractor?
How about your therapist or psychologist?
If the answer is yes, did you tell them that you had weight loss surgery? If not, how come? What the heck are you waiting for?
It's vitally important for you to inform every one of your healthcare providers that you've had weight loss surgery.
You do know you're supposed to be wearing a medical ID bracelet informing others that you've had this surgery, right? Why? Let's imagine you're in some sort of an accident and can't speak for yourself. You've been surgically altered. The rescuers need to know this before they do anything to you.
This is why you should have an ID bracelet that says no blind NG tube, no NSAIDs. Serious damage could happen if a medical professional in the field tries to give you an NG tube without knowing about your altered anatomy.
The same could be said for all your other healthcare providers. They need to know that you're a surgically altered freak.
They need to know that you can't take certain medications. They need to know that you're on vitamins, so when they prescribe medications to you, they understand what they are giving you and how it will affect you. You would be surprised at how little other medical professionals outside of bariatric specialists really know about this surgery. It may be up to you to educate them. Don't assume that they know it all.
It's up to you to be proactive at letting them know you've had this surgery. Don't assume they've read through your entire medical history. Tell them.
As for me, when I tell them and they start asking questions, I direct them to the ASMBS website where they can get more information.
Sometimes you can help other medical professionals alter their reality.
Why, yes you could.
Yeah, that was a nice break right there. Welcome to Altered Realities.
Do you remember attending your doctor's seminar or pre-training and they talked about taking vitamins for the rest of your life?
And you remember saying little prayers up to whomever, if I get approved, I'll do everything like I'm supposed to. I'll eat right, I'll take those vitamins, and I'll exercise.
Funny, after all these years, I find the thing that most people need to do the most, they seem to do the least and think it's okay.
Recently, our friend T2 Nashville posted on our forums that her surgeon said, you have to remember that to a bariatric patient, vitamins after your surgery are like a prescription medicine after any other surgery. You need them to survive.
So why don't we take a look at what can happen if you don't take your vitamins? How about we start with calcium?
If you don't take enough or the right type of calcium, you can suffer from lovely. You can suffer from osteoporosis, osteomalacia, Okay, wait. Osteoporosis. Osteomalacia? Is that right?
Osteomalacia? I think that's just south of Burma and just north of Sumatra.
I think it's over by Laos.
I think so.
Okay, ready? Let's try this. You can suffer from osteoporosis, osteomalacia, hypothyroidism. Damn you, Tony Tao! You can suffer from osteoporosis, osteomalacia, hypoparathyroidism, muscle cramping, hypotension, and bone pain.
You rock!
Mommy gets muscle cramping.
If you don't get enough iron or the right type, you can suffer from anemia, fatigue, hair loss, feeling cold all the time, rapid heartbeat, brittle fingernails, severe menstrual bleeding, headaches, abdominal pain, and disturbed sleep. And in severe cases, a desire to eat ice, paint, and dirt. This is called pica.
Seriously.
How's that dirt?
Yummy. Zinc, lack of libido.
Not tonight, honey. I have a headache. Are we trying to scare you? Hells yes, but only because we care.
You made those promises early on. Keep them. There's still so much out there that we don't know about this surgery. Yes, research has come a long way, but do everything you can to keep from becoming a negative statistic in the world of weight loss surgery.
Listen, my mom had surgery 15 plus years ago. She was told only to take a one-a-day vitamin. Guess who is now suffering from the effects of those vitamin and mineral deficiencies? She now has osteoporosis. I can't blame the doctors really. They thought they were giving her the best advice at the time.
And if you've had surgery already, do everything you can to keep abreast of the latest research. You just never know how it will affect your future when you continue to get your freak on.
It's time for PTV Coffee Talk.
I'm Linda.
And I'm Tony.
And welcome to Coffee Talk.
Did that last segment scare you a little? Are you worried about the cost of bariatric vitamins? Well, we just want to put things into a little perspective.
I've heard a lot of people complain about the cost of bariatric vitamins and saying that they cost too much.
I want you to think about this. Before surgery, I had, let's say, habits. Every morning on my way to work, I would stop off at the local convenience store to pick up breakfast. Say a diet soda and a ho-ho. Average cost per day, $2.99.
And every time I went grocery shopping, I would throw a little something in my cart, whether it's an ice cream, candy, or sodas. Believe it or not, this stuff adds up to hundreds of dollars that you shouldn't or won't be spending anymore.
And drinks with meals? Say you drank a soda or purchased a soda at a restaurant. Well, we know you won't be doing that anymore.
The point we're trying to make here is your regimen of vitamins, and let's use Bariatric Advantage. Costs about $1.85 a day. Now, I'm sure you can think up some daily habits that you will give up or have to give up post-surgery that will help you cover these costs. Heck, if you want to give up those bad habits before surgery, put that money into getting a head start on your vitamin stash.
Don't fret about the costs. You are totally worth it. And so are these vitamins. Well, once again, we've come to the end of our show. Thanks for stopping in.
Be sure to tell your friends about us, especially those who don't think they need to take vitamins.
Bye-bye.
Zinc, lack of libido.
I lost my mojo.
I lost my mojo.
Nice, Danielle.
Oh, I need to be chewing on a paint sample. Okay.
No, actually, you're going to eat dirt out of a...
Okay. Zinc.
I like that. She just goes, no, you're just going to eat dirt. And you go, okay. No, don't even question it. Just go, okay.
I'm nothing if not a trooper.